digging into the playbook, it sets forth first, things to consider when to open safely. And I say consider, but really the language from the playbook is, all employers must implement and update as necessary a plan to reopen that, one, is specific to your workplace. You need to take into consideration how your work site may be different from another work site, and what potential risks are unique to your work site for COVID-19 transmission. Do you have customers come in? How are your employees interacting with each other? And that involves identifying areas and job tasks with potential exposure to COVID-19. If you're a restaurant, certain job positions are going to have a lot more customer contact or a lot more employee contact, which will certainly increase the risk of exposure as to compared to another, maybe a back office position. And so you need to take those differences into account. Your plan needs to include control measures to eliminate or reduce such exposure, including screening, PPE, and sort of things we've always talked about. And then maintain a healthy business operation and maintain a healthy work environment. What does that mean? I don't know beyond implementing the other more concrete issues and suggestions. It emphasizes the need to provide effective training for workers, not just setting up a system is one thing, but conveying that to the staff so that they understand the rules and the expectations and the resources. And then, perhaps controversially, encourage workers to give their input into an effective work plan. And employers are encouraged to talk with your workers about plan changes and to seek their input, and to effectively communicate important COVID-19 information. So that's the plan that the playbook wants you to set up for reopening or continued operations. And moving on, it also talks about additional things that you need to do before you're reopening a facility. You need to perform a detailed risk assessment and create a work site specific COVID-19 prevention plan. If you've done one of our previous webinars, we've talked about a lot of the counties have their own specific protocols for reopening. I know LA County certainly does. Many of them that you have to post at the work site. So hopefully you've already given some consideration to doing this, but this just reinforces that you need to do that. You need to train workers how to limit the spread of COVID-19, including on how they should screen themselves for symptoms and when to stay home. If they're having symptoms, they need to be, advised and communicated with to stay home if you're not feeling well, or if you took a test and you're still waiting for the results, or if you've been exposed to somebody with COVID-19, to stay away from the workplace in the first instance. Setting up individual control measures and screening for employees, for customers. Your facility needs to put disinfection protocols into place, which includes, high traffic areas being cleaned more regularly, soap and water available, hand sanitizer, things like that. Establishing physical distancing guidelines, which can include both operational procedural things, but also physical barriers. And then establish a universal face covering requirements in accordance with the Department of Public Health guidelines, which we'll discuss in much more detail here shortly. If you move on to the next slide. So one of the more concrete things it starts to get into is outbreak identification preparedness. So one thing that you need to do, which you've probably already done it maybe informally, but formally, is designate a workplace infection prevention coordinator to implement the COVID-19 procedures and to manage COVID-19 issues as they occur. And if you're listening to this webinar, especially if your boss directed you to watch this webinar, that person's probably you. So embrace the title. It doesn't come with a salary bump, but congratulations. This next one, we'll talk a little bit later about potential state and federal leave laws that may apply to COVID-19 situations. But above and beyond that, the playbook also talks about ensuring that the sick leave policies are sufficiently generous and flexible to enable workers who are sick to stay home without penalty. So it sort of suggests giving serious consideration, or actually providing more leave than the law requires in order to foster a workplace where employees don't come to work sick or uncertain as to whether they're sick. What that specific is, the playbook doesn't mention, but it says to give consideration to that. As we mentioned, instructing workers on when to stay home and not to come into the workplace, the process for calling out. Also, even before you have an outbreak, you need to develop a mechanism to track cases. Let's say you have an employee who calls you and says that they've tested positive. What do you have to do contact tracing so that you can advise the relevant employees that they may have come into close contact with this employee? We'll talk about communicating a little bit later, but from the ground level, how are you going to identify the persons who may have been in contact with this employee? So you need to develop a plan for that. And then identifying a local health department contact to notify if there's a suspected outbreak. One of the positives of the playbook is it actually defines an outbreak now as 3 or more lab confirmed cases within a 2-week period among employees who live in different households. So if you have 3 or more employees, separate households in a 2-week period who test positive for COVID-19, that is now the definition of an outbreak.